This is Jim Polarine, Senior Technical Service Manager with STERIS Corporation. It's a pleasure to be here today and to be able to present to you at Cleanroom Technologies Conference. I would love to be there in person. In fact, I had uh, purchased airline tickets and hotels, but unfortunately, this past Thursday evening, my grandmother, who was like my parent, my mother and father, passed away. So this coming week here, I'm actually planning her funeral services and visitation. So I thought I would go ahead and present and just do this electronically. And if you have any questions, you can reach out to Cleanroom Technology or our STERIS folks there at the show. So I'm here to present on a roadmap to a successful cleaning and disinfection program that meets the Annex 1 guidance. There's some key things that I'm going to be talking about here today. One of those are some of the most recent guidance documents and regulations in the clean room industry related to cleaning and disinfection, including the new Annex 1. I'm going to talk a little bit about the different disinfectant technologies and their application in the clean room. Then I'm going to finish off the presentation talking about rotation, cleaning and disinfection frequencies, and then rinsing and residual removal. So let's first talk a little bit about some of the guidance documents and regulations in the cleanroom industry. I think it's very important here to look at this picture holistically at the contamination control strategy, which is now a key part of the new Annex 1. So I wanted to go ahead and point this out. This actually comes from PDA's technical report number 90 on which includes CCS, and it does talk about how to develop a contamination control strategy. So this is our contamination control house. These are the key foundations at the bottom. So SMEs with scientific knowledge, quality risk management, QR9, personnel awareness, quality culture. So having a quality culture is very important to the whole facility design there. And then, of course, one of the key things that I'm going to be delving into here is contamination controls. And some of those are things such as cleaning and disinfection, clean room design, personnel gowning and hygiene, process design, vendor audits, uh, consumables, any type of material that you're bringing in, you would want to conduct audits and yearly reviews. And then there's the validation controls, the monitoring controls for the clean room, so environmental monitoring, pest control program, etc. And up at the top, a governing board, which oversees your contamination control strategy. And just remember that this all involves continuous improvement. So when newer technologies come online, such as rapid micro methods, those are things that you may want to validate and institute. And also keep in mind, this is a very holistic approach. It doesn't involve just isolators, biological safety cabinets, or RABs, but it's your clean room as a whole. So please keep in mind that this is an ongoing process. It involves change control. And certainly, whenever there is an investigation needed, you want to you want to definitely open up a CAPA investigation if you have excursions. And you want to use all of your monitoring controls and take a look at your overall contamination control program. So moving on here, your most common sources of contamination in the clean room come from aging facilities. So we know as clean rooms age, they're designed to last around 20 years before you start to have issues. So with the aging facilities, things like the ductwork, and when we take a look at clean room floors, the sealant on the floor can tend to break down over time. And as that happens, it can potentially be a contamination source. So please keep all of that in mind. And then, of course, material transfer. So anything you bring into the clean room, carts, cartwheels, bags, boxes, intervention tools, equipment, pallet jacks, Zambonis, any of that can be a potential source of bioburden. And then, of course, personnel. That's about 80 to 85% of your overall contamination in the clean room are operators and visitors to the clean room. We shed millions of particles and millions of skin flakes a day, and all of those can potentially contribute to the bioburden in the clean room. And then, of course, your processing. So, whatever types of products you're making, whether it's a liquid, gel, capsule, a powder, any of these can potentially lead to buildup of contamination in the room. I know I was at a facility recently in Indiana where they were making a depression drug. It was leaking on the floor and complexing with a phenolic disinfectant, making a red and yellow appearance on the floor, and it was actually fairly hard to remove. So certainly drug products can lead to contamination issues in the room. And then, of course, utilities, water systems, you can get biofilms. And then when we start to talk about compressed gases, helium, nitrogen, and argon, those can be an issue as well because when it comes to compressed gases, certain organisms like Cutibacteria macnes, which can live in aerobic or anaerobic environments, can live in that kind of environment. And of course, equipment, wherever you place that equipment in a room, if you block that first air or that HEPA filtered air over the aseptic zone, that can potentially lead to additional contamination in the room. So we don't want that to happen. One of the best guidance documents out there in the industry, and it is going to be updated in the next 2 years. Ed Tiswell is going to be leading an effort with the USP Expert Committee to update this document, and that is the United States Pharmacopoeia General, Chapter 1072 on disinfectants and antiseptics. So it does talk about the most common sources of contamination, which of course are people, items that are transferred into the clean room, aging facilities. The other key thing that is addressed in this chapter is, of course, validation. So it does talk about the level of log reduction, 2 log reduction for spores, 3 log reduction of vegetative bacteria. So it does give a lot of very useful information. I would recommend getting a copy of the latest version of it. Another key thing where we find a lot of guidance in the industry is to keep an eye on the latest 483s and warning letters. So you can see from this example, this recent 483 that came out by the FDA, that the regulators are certainly looking at molds, and especially when mold gets on the operators, especially when you're testing the gloved hands after they've been, let's say, in a aseptic BSC environment. And if you pick up mold spores on the gloved hands, they get very concerned about that. They would want you to do an investigation into that to potentially find out the sources and eliminate them. So they are taking a close look at these kind of things. We know in some of the new ATMP facilities in the US, they have about 25 to 30 drugs on the market now, and in Europe, about 15 or 16. But these are environments where operators are going in and out of BSC hoods on a frequent basis to do manipulation of T cells and cells that they've got in the hood. So that is a high risk environment. We certainly don't want mold or bacillus contamination getting on that operator or on the gloved hand inside the hood. Another key thing is disinfectant validation. The new Annex 1 does talk about doing suitability testing and testing the effectiveness of the disinfectants that you're using in the clean room, including in-use expiry dating. So if you're going to use an alcohol or a quaternary ammonium disinfectant for, let's say, 30 or 60 days, you most certainly would want to have stability and efficacy data to support that. And it's not just me saying that. So the FDA regulators actually are looking at that. I recently had a conference call with a clean room facility in Singapore. One of the questions came up there is, do we ever need to repeat the validation once it's done initially? The answer to that is yes. So about uh, every 5 to 7 years, you want to take a look at your overall validation. And as in this example here, their validation study was 10 years old, their coupon study, and they found that in-house isolates were not actually tested from the gowning room, and several of the coupon surfaces found in that gowning area were not tested either. So anytime those kind of things happen, that would be a cause for concern, and you most certainly would want to include that. There was even some discussion as to whether they were actually testing the spore phase of the organism or the vegetative phase. So you would want to make sure that you're testing the actual spores if that's part of your testing. So regulators do look at this, and on an annual basis, if you see a microorganism in your EM trending that appears to be very hard to kill or very frequently occurring, you would want to make sure that that's also part of your disinfectant validation program. And regulators are also looking at the application procedures. We're going to talk a little bit about that in this training here, but I can tell you that contact time and wet contact time is very critical to the usage of the disinfectants and sporicides in the clean room. The surfaces in the room when you apply them with a microfiber or polyester mop head need to be wet for at least 10 minutes or whatever the validated contact time is, because you certainly want to make sure you get good coverage and that you are getting that good wet contact time. So in the US, disinfectants, sporicides, and sanitizers are all regulated by the United States EPA. And the US EPA stands for Environmental Protection Agency. They regulate the safety, the use, the disposal, and the efficacy of these products. And this happened back in the 1980s, so they took over regulation from the USDA. They also regulate the claims. So EPA has a certain claim structure. I've outlined it here, and requirements. And most of these claims with the US EPA, many of these test methods come from the 1960s or before then even. So they're very old, they're antiquated, they're very difficult to repeat as well. So I wouldn't recommend end users, so the pharma biotech customers, to try to replicate these methods. But these are what are required to register products in the United States as sanitizer, disinfectant, or a sporicide. When it comes to Europe, we have the EN test methods, and there's a 3 tiers to these methods. So phase 1 are suspension studies, where the microorganism is surrounded 360 degrees by the biocidal agent. Then in phase 2, this would be like the EN 13697, which is a coupon study. That is the most common method used in Europe for validation. You also see it in Brazil and some of the Latin American countries used. And then phase 3 is testing under practical conditions. So this would be your in situ validation. And I also call these disinfectant field trials. It's something I published on quite a bit in the past few years. So what is the term sanitizer? What does it mean? It actually means that you get greater than 99.9% reduction of vegetative bacteria. It's a 3-log reduction on new non-food contact surfaces, a 5-log reduction on food contact surfaces. So the good example here would be 70% isopropanol, 70% ethanol. And the reason it's 70% is you need a certain amount of water, around 30%, to move the biocidal agent, so the sanitizer in this case, through the cell wall and cell membrane and to destroy the host cell. So that's why it's 70%. Most of these products are all used on pre-cleaned surfaces that have already been cleaned with a disinfectant or a cleaner first. Then we have disinfectants. So in Europe, we mainly see quaternary ammoniums or quat mixes. These kind of products are designed to kill 100% of all vegetative bacteria, target viruses, and target fungi. The US EPA, I pasted in a link here to show you what the most current methods require. With the EPA testing, you have to get a 4-log reduction of bacteria, a 3-log reduction of viruses, and in most cases, disinfectants do not require a pre-cleaning step because most of the disinfectants used in the US and many of the ones in Europe, at least in the US, they're registered as one-step cleaner disinfectants. So they both clean because they have surfactants, and they provide a moderate level of kill. They're also tested in the presence of 5% bovine serum albumin, which signifies a moderate soil load. Then we have the sterilant, this most difficult test to achieve, as you see pictured over here. These are what surfaces are used in the sterilant test with EPA. So Dacron silk suture loops, which are more on the porous side. And the non-porous surfaces here, we have porcelain penny cylinders. So they are all coated with a 10 to the 6 concentration of bacterial spores. So the aerobic spores are Bacillus subtilis, the anaerobes are Clostridium sporogenes, and you have to get a 6-log complete kill on all 720 carriers. So you would be testing 720 carriers of porcelain penny cylinders and then silk suture loops with each of these different types of bacterial spores. And you have to have 0 positives in order to get a sterilant claim with US EPA. So it's a very rigorous and difficult to repeat test. So now let's talk a little bit about the disinfectant technologies and the different ones in the market today. First off, I want to mention that the most critical thing to think about when choosing a new disinfectant may vary somewhat depending upon what type of manufacturer you are. But I would say overall, what I see when companies want to choose a new disinfectant or sporicide is they look at efficacy. If it doesn't kill your environmental isolates, your organisms in the clean room, you're probably not going to use it. Another key thing is substrate compatibility. So you want to be able to have good compatibility with the stainless steel and other surfaces in your clean room. Another key thing, and FDA does look at this, is stability. So open container and used dilution stability. And then safety and disposal. So you want something that's going to be safe for your operators to use and apply, and something that is disposable down the drain to the sanitary sewer system. And then, of course, something that is rinsable from the surfaces in the clean room that you can easily rinse from the surfaces either with water for injection, 70% IPA, or by using a cleaner followed by a rinse step. So a very nice article came out during the pandemic at the end of it. And this article came from the Bioforum group, which was looking at the most important criteria when selecting a new disinfectant or sporicide. So I thought it was helpful here to list what those criteria are. And the focus of the article was actually on how to do a global disinfectant validation study. If anyone's interested in, I'm happy to share it. I listed it down here. It came out in March 2020. So they said that number one is cost, storage, disposal, and shelf life. So all of those are number one. Number two, safety and PPE that's required. Number three is presentation. So is it in a trigger spray? Is it in a unit dose? Is it in wipes? What is the presentation of the product? Four is efficacy. Five, six, and seven are compatibility. So it's not just compatibility with surfaces, it's compatibility with the other biocides you're using and your application equipment. And then, of course, we have wet contact time is also critical as well. The surface needs to be wet in order for the product to be killing what's on that surface. And then finally, it needs to be rinsable. So you need to be able to rinse the residues from that surface easily. Here are some of the most common chemical types. So when we look at disinfectants in the US, we have phenolics, we have those in Asia and Latin America. In Europe and in other parts of the world, we have quaternary ammonium disinfectants. Several of those are on the market. As far as sanitizers, 70% IPA, 70% ethanol. We also have 3% hydrogen peroxide, which could be a sanitizer. And there's a whole host of sporicides out there. So sodium hypochlorite, which is bleach. There's also a calcium hypochlorite. Those are sporicides. Chlorine dioxide, where you take lactic acid and a base and you mix it with water. That's sporicidal. 6% hydrogen peroxide, sporicidal. Peracetic acid at concentrations of 0.006% to 1%, sporicidal. Peracetic acid, hydrogen peroxide blends are also, there are several of these on the market in Europe and the US. That's a sporicidal technology. Glutaraldehyde and formaldehyde, if anyone watched the National Geographic special on the Marburg virus, you'll see that they went and they fogged these areas with, they gassed the areas with paraformaldehyde. That's where you burn it off in a pan and you spread it to the different rooms that had the monkeys in them. Ozone certainly could be a sporicide. It's used in water systems. I've seen it used in Puerto Rico where it was used in the locker room area for the counting. Nitrogen dioxide would be another good example, and that can be used in RABs and isolators. And then, of course, vaporized peracetic acid, and probably most common sporicide used in RABs and isolators, vaporized hydrogen peroxide. So the good thing about quats, they're excellent cleaners. They have a broad spectrum of activity. Many of them are registered in the U.S. With the EPA, and they're alkaline in terms of the pH range. The cationic surfactancy provides very good cleaning. They come in many different formats: trigger sprays, wipes, sterile and non-sterile. They also come in gallons. The limitations: it doesn't kill bacterial spores. You need a sporicide for that. They're not always TB effective. In order to get TB efficacy, you'd have to have a lot of alcohol in the formula. And you should never use quats and phenols on the same surface. So we recommend in the US to either go with phenols or to go with quats, but not both. And then you have hydrogen peroxide peracetic acid blend. So very common products in the US, Europe, and globally. They have very enhanced efficacy claims. So with the US EPA testing, they have claims against a whole host of enveloped and non-enveloped viruses, against a very hard to kill fungus, Aspergillus brasiliensis, and bacterial spores. They also have very good stability. So anywhere from 96 days for open container and around 24 months for closed container. And if you look at the comparison, the problem with 6% hydrogen peroxide is it takes a longer time to build up efficacy, anywhere from 30 minutes to an hour, whereas hydrogen peroxide peracetic acid blends much faster acting. As you can see here, in about 5 to 10 minutes time, you're getting very good efficacy from your sporicide, whereas 6% takes a long time to build up. And then bleach, so at concentrations of 1,500 ppm of available chlorine, you'll see bacterial efficacy against spores. And at 5,000 ppm, you'll see fungal and bacterial spores with efficacy with sodium hypochlorite, which is bleach. The biggest downside is bleach is not compatible with everything. So you may see some compatibility issues with it, especially when it's used on soft metals like copper, brass, aluminum, galvanized metals, and mild steel. And another thing with bleach is it's not compatible in all circumstances with stainless steel. So keep that in mind as well. These are some of the key factors that can influence the performance of these products. So the pH of it, the temperature, if you're using it in a cold room, and we know that there's a lot of cold rooms in use, especially in the ATMP industry. So certainly that can affect the efficacy. The colder the temperatures, the slower the reaction. So you may need a lot longer contact time. And actually the reverse is in place. So if you have very hot water that you mix it with, you may see an increase in efficacy, at least temporarily. Wet contact time, as I mentioned, is critical, and you should be timing that when you apply the products with a clock or a stopwatch. And I think the first time you do it, you'd want a calibrated stopwatch to time it. Concentration is also critical, so you need to make sure that you dilute the product correctly. Having the correct dilution is really critical. And keep in mind, different surfaces, you may have slightly different performance. So if you have older clean room flooring, we've seen this with some of the vinyl flooring. If it's, say, 20 years old or older, what happens is that sealant layer does start to break down on epoxy and vinyl floor, and that it may need to be replaced. So we've seen that actually happen. So the surface can be important too. The presence of organic matter can affect the efficacy, and water quality. So now I'm going to move a little bit into cleaning methods, cleaning frequencies, and rotation. So rotation, it's changed a lot over the years. Back in 1999 and in the 90s, rotation, I believe there was a big belief out there that you had to have a high and a low pH disinfectant for your rotation. But around 2000 to 2005, that myth was demystified by Dr. Scott Sutton and the USP expert committee. So Jim McGallico and Tony Kendall were part of that. And basically, ever since then, there has been a stance in the industry, and PDA's technical report number 70 expounds on this, that rotation can be one disinfectant with good efficacy against especially your vegetative organisms, some of your molds, and a sporicide. That works very effectively. You have to have the sporicide there, whether it's bleach, hydrogen peroxide peracetic acid blends, because you have to be able to kill fungal and bacterial spores that you see in the room. And even a new Annex 1 does talk about this. So it says here in green, more than one type of disinfecting agent should be employed to ensure where they have different modes of action, their combined usage is effective against all bacteria and all fungi. Therefore, no disinfectant will kill all of them, so you have to have periodic use of a sporicide to address fungal and bacterial spores. And there are lots of references in the industry on this. So PDA's Aseptic Processing Guide from 2004, WHO and PICS, then we have PDA's Technical Report number 70, are all very good references. And there's about 5 to 6 fairly recent published industry articles on that topic of rotation as well. So if you take a closer look at here what PDA Technical Report number 70 says, it says that industries have moved away from rotation of the two disinfectants, and that currently you can have one disinfectant rotated with a sporicide, and that would effectively reduce the bioburden levels in your clean room. One other key thing I wanted to talk a little bit about here is the application. So it's very critical to have a good application of your disinfectants and sporicide in a clean room, and to mop and use wipers correctly. So whenever you're mopping the clean room, one of the things I wanted to definitely highlight here is whether you're using a 2 or 3 bucket cleaning routine, you need to change out that use dilution every 56 square meters with use dilution of disinfectant in bucket chamber 1 and 2. If you're using the product in a grade A or B clean room, and if you're using it in a grade C or D clean room, you would change out the dilution every 93 square meters. This comes from our IEST recommended best practices, which we're updating now, 18.5, and I believe it'll maybe 18.6 when we're done with it. But I highly recommend that you change that out, because if your solution gets too soiled or too full of particles, you won't get the efficacy that you need. So when you clean the surfaces, you should be doing a pull and lift method. I'll talk about that on the next slide. You should overlap your strokes by 20%, right? So 10 to 20% or 2 inches. You can do a modified figure 8. That's another technique that you can use with the microfiber or flathead mops. So here's the techniques. You can overlap your strokes. You can make 3 strokes on the surface and then re-moisten the mop head vertically. You can also do this horizontally with the microfiber or polyester mop head. You can also do a modified figure 8 and make 2 or 3 strokes on the surface here and then re-moisten your mop head. Either one of these are perfectly fine to apply the disinfectants, but I would actually train your operators on this, make sure they're doing it correctly, get the latest RP 18.5 and the newest version that's going to be updated that we're working on here. I would actually have that on file. So how often do you need to clean? Cleaning frequencies for your clean room should be based on certain key criteria, such as the grade or ISO classification of the room, the level of risk to contamination to your finished products, the activity level in the room. So when we talk about activity level, are operators going in and out of that area frequently? What does your environmental monitoring data for that area look like? And what type of processes are being performed? Certainly, if it's a more of a wet process, we'd be more concerned about mold, so you may need to clean more frequently. And one of the things I wanted to highlight here are some of the key products for the cleaning. So if you're using a sporicidal agent, you should develop a scientific rationale for using it. So it can be used weekly, biweekly, monthly, or quarterly, but that frequency should be tied into your environmental monitoring data and the frequency of hits of fungal and bacterial spores. So that should dictate the frequency. And certainly if you do have a big outbreak going on, you can use it more frequently during the outbreak. But I'd highly encourage you to do a CAPA investigation and find the source or sources of the mold or bacterial spores that are affecting the area. And whenever you look at frequency, you should put a nice table together like this in your SOP so that any auditor, internal or external or FDA, can easily figure out what your frequencies are. So for, let's say, a grade C area, you'd want to clean the floors on a daily basis with the mop, with the disinfectant. You would want to clean them all, the walls once or twice a week, typically twice a week at least. Door kick plates would be daily. Equipment in the clean room, so furniture, shelving, any type of equipment in the room, you would want to clean that daily. And if there's anything like fire alarms, fire extinguishers, or switches that come out from the wall, you would want to cut it out and then mop over it. So by cutting it out, you would take a wipe with disinfectant solution or sporicide, carefully wipe over it and around it, and then mop over top of it when you mop the wall there. And of course, any other furniture in that area, including chairs and carts, need to be cleaned as well. The frequency would then increase for an ISO 5 area. It would be after each operating shift, although in an ISO 5 area, you typically would not clean the ceiling because it's a solid row of HEPA filters. You don't want that HEPA filter to break loose and fall on the floor. So back in the grade C area, you can clean the ceiling in a grade C or grade D once a quarter or once a month. It's a very low risk area. So your SOP should look something like this, where we talk about the cleaning frequencies, whatever your cleaning agents are, quats, phenols, sporicides, rinsing agents can all be put in here. What surfaces are you cleaning? Walls, floors, ceilings, outside of equipment. What are the ISO classes of the room or the grades of the room? Grade A, B, C, D. And inside of each of these squares, you can denote the frequency. So D would be for daily, W weekly, M monthly, A annually, and S would be semi-annually. So let's talk here at the end a little bit about rinsing and residual removal. So we know that residue in clean rooms comes from many different sources. It comes from people, operators, and visitors into the clean room. We shed millions of particles and millions of skin flakes a day. These get on the surfaces in the room. We know that it comes from transport of materials, material transfer into that clean room. That's always going to be a problem. You should be using a sporicide on that, especially in ATMP facilities. So sporicidal wipes, spraying it with the sporicide, making sure to get good contact with the sporicide. Treatment of walls and floors with waxes and sealants, those can leave residue. And then certainly your drug components, those can be a source of residue too. As I mentioned earlier in Indiana, the depression drug leaking on the floor, complexing with the phenol, making a bright red color on the floor. And then of course, processing equipment and where you place that equipment in a room can also be a source of residual. We know that the FDA has been looking at residue studies for, as far as I can remember, back to say 1991. So they certainly do notice residue, especially if it's really built up on surfaces. So as you can see here, they do talk about all residues need to be removed on certain equipment surfaces, especially if it's a product contact surface. They would expect that. So in general, we would want the surfaces to be visually clean so that when you look at the surface, you don't see a caked on residue. You can use water for injection for rinsing. That works really well. You can use alcohol, 70% IPA, 70% ethanol. You can also use a neutral, acidic, or basic cleaner, followed by a water for injection rinse step. Cleaners are typically used around 1% concentration. And you can develop your SOP here and put a very nice template in there, just like you would for mopping with disinfectants in the clean room. It'd be the same types of methods. So overlapping unidirectional strokes, modified figure 8, except in this case, we're just using water for injection or a cleaner, followed by a whiffy rinse step. There's a lot of myths out there in the industry about residue, and a lot of the myths are not correct. So one of those is that this is a new focus by FDA. It's not. It's been going on, as far as I know, since 1991. And that all residue is caused by disinfectants. That's also not true. It comes from operators, equipment, material transfer, from aging facilities. All of those contribute to residual. Residue inhibits sporicides. We've actually published some studies in PDA literature and PDA posters to show that residue from phenols and quats, when it builds up either in a liquid phase or even when it's dried on the surface, it's reactivated. And it actually has, I would say, a synergistic effect in some cases with the sporicide on the surfaces. So we've actually published on that. Residue hides microorganisms and promotes microbial growth. That's another myth. We actually know that that residue has biocidal properties, especially when it's reactivated, and that residue can build up after each application of disinfectant. That's also not true. So we actually did a procedure here, and we wanted to look at residual buildup on surfaces. We used a swabbing method similar to using a mop in a clean room. And we did an application here, wet the surfaces for around 10 to 15 minutes. And we wanted to look at using TOC to look up at that residue and see what the buildup actually looked like on stainless steel. So let's take a look at that study. So what we found, and we used a quaternary ammonium here. We also used phenols for the same type of study. And what we found was after about 9 applications on that surface, that quat hits a steady state at about 9 applications. And after that, by wiping or mopping, you're actually removing some of that residue. So it's not building up at an exponential phase. It actually levels off after about 9 applications. And you're actually starting to remove some of that residual. So there's several different references that I covered here today. That I used in making up this presentation. I'm happy to share any of these with you that are not copyrighted, or I'm happy to let you know where you can find them on the internet. Several of these are actually being updated in the next 2 years. So that would be PDA's technical report number 70, IEST's RP 18.5, and USP 1072. You'll see new versions of these in the next 3 to 5 years. And today in the web-based training, I covered some of the most current guidance documents and regulations in the clean room industry. I covered some of the most common disinfectant and sporicidal technologies in the industry. I covered rotation, cleaning frequencies, cleaning methods. And then finally, I talked about rinsing and residual removal. So now if there's any questions, you can feel free to reach out to Cleanroom Technology or get a hold of me. I'm happy to share my email address with them and to take any questions. Thank you for your time today, and I look forward to seeing you next year.
Well, if we clap loud enough just now, Jim might hear us.